Welcome back to Rural Health Today. I'm JJ Hodshire, President and Chief Executive Officer. I'm your host for this podcast, and I'm excited today because it's Christmas. And what a wonderful time of the year. I'm also joined in the studio today by Kyrsten Newlon, who is our Director of Marketing and everything else here at Hillsdale Hospital, does a phenomenal job. And we have to have a disclaimer. We're technically not here on Christmas Day.
No, we're not.
But it's around the corner.
We're dedicated, but maybe not that dedicated.
It is cold outside here in Michigan. So if you're listening outside of Michigan, let me just paint the picture. Up until just a few days ago, the snow has been very deep and it's been very cold. Single digit, even below digit temperatures with the wind chill. Very cold.
Well, it's been a little rainy today. I'm really hoping we're still going to have a white Christmas.
No, I'm hoping not.
Really?
Really, yeah. It needs to be.
Where's your Christmas spirit?
Well, I was over it during the first, second, and third snow. Yeah, let's just have a Christmas. Really?
This is my favorite season.
Well, see, my grandson, his name is Eli, loves to go outside and play. And if it's cold, I'm old. So Papa doesn't do well. Hey, now, you didn't have to agree. Papa doesn't do so well when it's cold out. And that little kid, he would withstand the most frigid temperatures to play outside. So I'm hoping that this Christmas it's a little less white and a little more warmer for us to go out. So, Kyrsten, it's great to have you back in the studio. So today we're going to do something fun.
Yeah, it's Christmas Day for our listeners.
Yes, it is.
We aren't going to have a serious conversation today. Today we're going to do something fun. We're going to tell a hospital Christmas story. And JJ doesn't know what the story is. And
no
to be
idea.
honest,
I'm a little scared.
I don't really know what the story is either because we're going to play some Mad Libs.
Oh.
So for our listeners who don't know what Mad Libs are, basically I'm going to ask you. Oh, great. So I'm going to ask you for some words. I'm going to ask you for a verb and an adjective, things like that. You're going to give those to me, just whatever you want, out of your own imagination, and it's going to fill in the blanks of the story.
Okay.
And after that, we'll read the story. So the story is the traditional "'Twas the Night Before Christmas" in a hospital.
Now, question here.
Yeah.
So are all the answers, are they healthcare related?
Most of them, yes. Yeah.
So they have to be.
It tells a story in the hospital, but the prompt will kind of guide you.
And the prompt is given by you?
Yes.
Now you do, but you already know what we're going to talk about or no?
No, because you're going to be telling us what the subject of the story is. You just don't know the context.
All right.
So
okay, let's do it.
Let's do it.
All
so
right.
First of all, JJ, I need from you a position at the hospital, a kind of healthcare worker.
I'm going to say respiratory therapist.
Perfect.
Thank you.
The next thing I need is a medical supply. Anything that would fall under that category.
How about, let's go with a common, gloves. Is this boring?
No.
Okay.
The next one is a symptom. Any kind of symptom a patient might come to the hospital with.
Fever.
Okay. How about a classic hospital food?
Jell-O.
I like it.
Thank you.
All right. A healthcare apparel. Anything that, someone who works in healthcare might wear.
Scrubs.
Besides scrubs.
Okay, you're helping me. Apparel that they may wear. How about nurse cap?
Yeah.
Okay.
The next one is a patient care duty. Something that is involved in patient care, something that nurses or doctors have to do.
Okay, so direct patient care. How about, you don't want anything general like rounding or anything of that nature?
Totally up to you.
Let's say toileting.
Okay.
Come on, we got to make it somewhat
Oh, yeah.
fun. Okay, all right, maybe. All right.
All right. The next thing is a little bit interpretive. A noise you might hear in the hospital.
Oh, I'm certainly not going to say scream. So let's say a noise you'd hear. Chime of a call light.
Okay. The next one is any object in the hospital.
Bedpan.
Okay. I should have seen this coming.
Come on.
All right. How about another healthcare position, another job at the hospital?
Director of marketing.
Oh, great. A number.
Just a number.
Any number.
I will use 51.
Okay. And then a department or unit in the hospital.
Radiology.
Great. The next one is an exclamation or type of expressive reaction.
Wow.
I thought that you were reacting to the prompt.
No, that was
okay.
Yeah, I was not really excited about the question.
Okay.
Yeah.
Wow. Gotcha.
Wow.
Okay. How about a contagious disease?
Influenza.
Classic. The next one is any place in the hospital.
Laundry room.
Okay. It's an important place.
Very.
Another hospital object.
Just like medical device or?
Yeah. Medical device or just an object that might be in the hospital.
Okay. Let's say a CT scanner.
Good. And another one.
Oh, MRI.
Good. Another hospital position.
Registered nurse.
Great. How about another piece of hospital apparel?
Let's say mask.
Okay.
Will that count?
Yes, that's
okay.
good.
Okay.
And then another type of medical supply.
Bandage.
Okay. The next one is another type of medical supplies.
Wow. Let's say scalpel.
All right. This is turning out to be quite the story.
Is it? Nice.
How about another healthcare position?
Let's go with, let's do a tribute to our longest standing employee, almost 60 years. Let's say
Absolutely.
Risk manager.
Not an easy job.
No.
All right. Something red.
A newspaper.
What?
Oh, okay. You mean the color red. Let's say blood.
I did not get that at
No,
all.
you didn't.
Blood. All right. That's funny.
Bless her heart.
Another medical supply.
Oh, my goodness. Seriously?
Yeah.
Let's go with, oh, my. Forceps.
Okay. How about an adjective to describe a healthcare worker?
Amazing.
And an adjective to describe a patient's condition?
Let's say does it have to be a medical term?
No.
Okay. Very bad.
Okay. Okay. Just a few more. How about an action?
Run.
And another expression or reaction of some sort?
Fantastic.
Can you give me another hospital food?
Ice cream.
How about an adjective?
To describe something. Adjective to give.
Speechless?
Yeah, speechless.
I thought you were maybe just acting it out for
me.
Yeah,
I was.
Can you give me another adjective?
Happy.
Okay. Last one. A type of vehicle.
2008 Cadillac DTS.
Very specific.
Well, you know.
DTS?
DTS.
Okay. All right. Are we ready for the reading of the story?
Yes. Are you doing it?
Yeah. I don't know.
So do we do music or anything?
Oh, yeah. There will be some music that comes on. We're going to change the lights here.
Nice.
It's cozy.
Cozy
for
the
Christmas.
Night before. Or no, we're not. Are we singing it?
Oh, no, we're not going to sing it.
Okay.
I mean, you could sing it if you want.
All right. I will after you're done.
Okay, great. 'Twas the night before Christmas, when all through the hospital, not a healthcare worker was stirring, not even a respiratory therapist. The gloves were hung by the chimney in care, in hopes that J.J. Hodshire soon would be there.
Oh, I didn't give myself a
We slipped that in there.
Okay.
The patients were feverish in their beds, while visions of Jell-O danced in their heads.
That's a good one.
The house supervisor in her scrubs, and I in my nurse cap, which worked out so well.
Worked out great.
Had just settled down for a long toileting. When out on the floor,
there is that.
I heard a call light chime.
See, that works.
I sprang from my desk to see what was the matter. It doesn't rhyme, but that's okay.
No, but it's okay.
Away to the window, I flew like a flash, tore open the shutters and threw up the sash. The moon on the breast of the new-fallen snow gave the luster of midday to bedpans below.
I do like that. That's cool.
I think this version is better than the original.
I do too.
When what to my wondering eyes should appear but a director of marketing and 51 radiology patients.
Yeah, about that.
With a wow, I knew in a moment it must be J.J. Hodshire. More rapid than influenza.
Oh.
His coursers they came. I've never understood what that meant, really.
Me either, but we'll Google it later.
Okay, sounds good. And he whistled and shouted and called them by name. So up to the laundry room, the coursers they flew with a med cart full of CT scans and MRIs too.
Oh, that's good.
Yeah. And then with a twinkling I heard on the helipad the dancing and singing of each little registered nurse.
Oh, that's amazing.
As I drew in my head and was turning around, down the chimney, J.J. Hodshire came with a bound.
Oh, wow.
Yeah.
Must have big chimneys around here.
He was dressed all in masks from head to foot.
Okay, that works.
And his pockets were filled with bandages.
Oh, see?
Of course.
Appropriate for the
Of course.
hospital. Absolutely.
A bundle of scalpels he had flung on his back. I hope you're okay, by the way.
I think I'm going to be injured at this point.
And he looked like a risk manager, just opening his pack. His eyes, how they twinkled. His dimples, how merry. His cheeks were like blood.
Wow, that's getting a little graphic. That's from all the scalpels that fell out of the bag, hit me in the head.
His nose like a forceps.
Move on.
Just need a minute.
Oh.
You said it.
I know.
He had
hamburgers around the house for everybody.
He had an amazing face.
Well,
I don't know
can't
why
go wrong
that's
there.
the funniest one.
Oh, really? Okay. Okay.
And a very bad belly.
Well, there is that. That shook.
That shook when he ran, like a bowl full of ice cream.
I should have used Jell-O there on that one.
He was speechless and happy. A right jolly old podcast host.
Yeah, there we go.
And I fantastic when I saw him. in spite of myself.
Oh.
I guess.
Yeah.
He spoke not a word, but went straight to his work.
That's not me.
Yeah. But it did say you were speechless.
Okay, well, there is that.
I'm a little speechless myself.
Me too.
And filled all the staff lockers, then turned with a jerk. He sprang to his 28 Cadillac DTS.
Nice.
But I heard him exclaim ere he drove out of sight.
2008.
Oh, what did I say?
28.
28. 2008.
2008.
I skipped zeros.
Yeah, that's all right.
Merry Christmas to all, and to all a good shift.
Oh, well, thank goodness we ended with shift, given we were talking about bedpans. Well, listen, that was an absolute amazing story. And they call it a what now?
A Mad Lib.
A Mad Lib.
I don't know why.
Now, have you been doing this all day? Because I'd be interested to know.
I spent a little more time on it than I anticipated.
Yeah. It looks like a lot of work.
I had some help.
Okay.
Yeah.
Nice. Who helped you out?
Our content production assistant, Vanessa, helped us out.
Vanessa Brown. I know her.
I couldn't have done it without her.
Yeah. She's amazing. I'd like to hear her version someday.
It's great.
Is it?
It's great.
I can only imagine.
Yeah.
Well, Kyrsten, to our listeners, first of all, very fun time here in the studio. But to all our listeners, we wish you a very Merry Christmas. And as the weeks follow, a Happy New Year.
Absolutely. Merry Christmas to our listeners.